Alrighty, welcome back to Your Pet, Your Vet. Last time we talked about radiographs or X-rays. Well, I've got to look at some now that we've taken, and I think you'll find it very interesting to see some of the specific cases that we see. Okay, here we are. Here's one case we just are working with now. This involves a 9-month-old neutered male golden doodle. That's that neat combination of a golden retriever and a poodle. Believe it or not, they make great pets. But this little dog named Sherlock ate some razor blades. Actually, it's a plastic razor blade, and you can actually see the metal components right here. So you can see how important this radiograph was, or we would have not known what in the world was going on here. This pet did go to surgery, and we were able to remove those successfully, and Sherlock is doing great. Now I want to show you the next one. Okay, now here's another dog that's had some chronic respiratory symptoms. Actually been to a couple other veterinarians, and again, we offered radiographs to try to figure out why this pet wasn't responding to treatment. It's being treated with various antibiotics and so forth, and had a chronic fever, and so we took these films, and this is fairly specific for a fungal infection called blastomycosis. Now this is Mir's heart right here. Now this is a lateral view. He's laying on his side. This is his heart right here, and this is his trachea or windpipe, just to give you some orientation. And this is his backbone or vertebral column. Here's his diaphragm that separates the thoracic cavity from the abdominal cavity. But normally the lung should be nice and black like this. This is probably the only area of the lung that's normal. All of this cloudy, we call it kind of a snowstorm appearance, is very typical of a what we call an interstitial pattern. And blastomycosis is a fungal-borne soil disease that we diagnose from time to time. It's very serious, and fortunately we were able to treat Mir, and we still are able. Some pets we lose contact with, but the last time I saw Mir, he was doing quite well, being treated with a special medication. But again, this is a nice way where you can actually make a definitive diagnosis using radiographs. Okay, now this is a kitty cat named Jack. Jack is a 13-year-old domestic short hair neutered male, and he had a history of chronic or reoccurring urinary tract problems, bloody urine. And again, the situation is that Jack required, he really wasn't responding to routine treatment, which essentially is antibiotics. Sometimes we use special foods, and so we had to figure out why Jack wasn't consistently responding. So here's what we found out when we took the radiographs. This is his abdomen here. He's overweight. All of this stuff right here is actually fat. Just so you know, he needs to go on a diet. But here's his urinary bladder right here. This shadow. And look right here, look at those mineralized densities, we call it. Those are stones, urinary stones. Now people get kidney stones a lot, but pets mainly get bladder stones or urethra stones. And in cats, it can really be a big problem. Dogs too, if it becomes obstructed, it can block the outflow of the urine, which can lead to renal failure. So this kitty cat did have surgery to remove those stones. And now he's on a special food that keeps those stones from reoccurring. It's really fantastic in that regard. Just want to show you a couple other things that I think you find interesting. This is one of his kidneys. In fact, you can actually see another kidney right here. So they're superimposed, the right and left kidney. You could see that if we had the other view to show you. And again, here's his thorax, and this is his liver right here. He's full. He needs to go to potty. This is a full rectum right here. He's got a lot of feces, is all that is. But the main thing we were doing here on this particular study was evaluating his urinary tract. We were suspicious there may be something going on in the bladder, and lo and behold, there sure was. Okay, this radiograph here is an image of it's not a frog. Kind of looks like a frog, but it's not. This is a 3.5-month-old puppy, a pit bull. And we're looking here, this time this puppy was presented because he'd been hit by a car, I believe. Is that right, Kristen? Yes, hit by a car. And what you're doing now is you're looking at the orthopedic status of the puppy. And I'm going to go ahead and walk you through what we're seeing here. This is the pelvis, a little box right here. This is the backbone or vertebra, and see the tail. Here are the femurs. Now you can see the growth plates. They haven't closed yet because this puppy's still growing. See those little gaps there and all the long bones? Those are growth plates. But if you look as you go down this leg, looky here. Here is the tibia, and it's fractured. As you can see, we don't have a nice intact bone here like we do here. So the tibia and fibula, which is a smaller bone, is fractured. If you come over here, this one is also fractured, but this is called a green stick fracture because it's not completely fractured all the way through. That bone is still actually holding together. The rest of the skeletal structures are normal. This was treated, fortunately, without surgery. Sometimes you have to do surgery, but in this case, particularly with puppies, it's not sometimes necessary. We are able to splint. We use what's called a Thomas splint is the term that we use, and which is a full leg splint, which immobilizes the leg, and so this bone can be reset and then allow it to heal by forming new bone, and this puppy is doing fine now. Okay, well, I hope everybody found that interesting. Again, I got to stress that radiographs have come a long way. I remember the days we used to have the old wet tanks, and they were good then, but now it's so much more sophisticated. The technology is so much better, and really it increases our diagnostic skills. So we really appreciate you tuning in this week, and we'll see you next week on Your Pet, Your Vet.